Dr. Mark Dargan Smith. He is the co-founder of Vita Longa and also the founder and CEO of Regenerative STEM, and also the co-founder and CEO of Regen STEM. And I'm going to read about his profile. Ở đây nói khi mình tập đi đi nhà sản phẩm hai khi ông này nói đến ở khi tất cả việc mình dân nhẹ tiết là quan quy chia tháp phần đất clinic Vita Longa nên chia tháp phần đất nên chia dựa vào bắt trong hôn Regen STEM. Dr.Mark Smith, co-doctor, PhD, chairman of the board, founder and dean of University of Natural Medicine, San Dimas, California, USA. He has lectured and practiced in health clinics throughout the United States, Canada, Central and South America, Asia, and New Zealand. He has studied and worked with osteopaths, homeopaths, naturopaths, and medical doctors in acquiring his expertise in the holistic health field, and offers over 27 years experience as an alternative health care practitioner of naturopathic medicine. Dr. Smith has coordinated the outstanding curriculum and design of the programs in the University of Natural Medicine and is responsible for the recruitment of the faculty for these courses. He has also developed numerous nutritional health supplements and currently is involved in stem cell research worldwide. Dr. Smith, bây giờ mình Smith cứ chia bài trên mặt đất nên chia group cứ chia nên chia mặt đất hai câu chia đi chữa xà lá nên chia tháp mặt đất mà hai chia lại ở sấp thoa mặt chiết nơi San Dimas, California, Sarah Americ hai quát chia group bằng riêng nên chia group chia ba nơi Sarah Americ, Canada, Americ, bay cận đá không bay cận bố Asia, nên New Zealand. Hai quát muốn sắc sáng một vừa ca chỉ mùi nên group đợt tây tiết làm mấy hai từ tua ban đã trùng niên nay bây giờ sát xem bị kia đừng biết bao sao trang trên một phải bao nhiêu năm nơi không ca chia ba nơi không bị sao bây giờ sát nên ca chia ba thòng chiết hai lớp Dr. Smith có chỉ nhẹ sập ráp sập rô nơi cam để thi sắc sáng nhẹ bằng cao nơi cam để thi sắc sáng đây mà hai chia lại bây giờ sát thòng chiết hai coi từ tua coi trời không ca ở chưa nữa nơi mất phải chia sắc sáng sập ráp vẽ sắc xa tại oni phòng đài hai lô Dr. Smith có ban một card này hai bằng pon chỉ trang mốc hai bằng pon sắp thử trang mốc hai sọc này qua bằng pon tại thưa cả nơi không ca sắc xa chiếm vì stem cell bị bệnh phộc lộ. Dr. Smith will be with us today to give representation about the regenerative medicine. Hai lô Dr. Smith này qua năng một thưa bằng hai đây vì cam chia bát để cam đó cả cả. Dr. Smith, the floor is yours. So, Dr. Smith.
Thank you very much. Hello.
Sustained on here.
I should have learned that in Cambodian, right? I'm very happy to be here today, and it's such an honor, and I want to thank Mr. Ju and Vita Longa for this opportunity to speak with you, and for Dr. Campon too.
Hai khi mà mình kết dụng á, là bài man chơi luôn chỉ một nét ngọc này thế này, hai xong con đó là Miss Chu nâng lược bị chạm mình đặt Campon.
Wasn't that an incredible presentation? Does that have you excited about changing your life after hearing that?
Hai bắt một hai được bao lộc Dr. Campon nó cứ bắt chữ cô ai chạm vào nó nên tết phần to bị nét ngọc này ban start bắt một hai được bao con hai ta nét ngọc này trong phạt đôi chỉ bắt bao nét ngọc này được tết.
I actually don't need to give this lecture because he's already said it all. I think it was Einstein who said great minds think alike, but the thing about it is everybody in here is a great mind, right? So we all think alike or we wouldn't be here.
And
judging by looking at you all, I think you already know enough about longevity and anti-aging, or maybe I don't have to say anything. Maybe you all should teach me.
Hayអ្នកអរគ្នាទៅនេះមកបន្តពីបានស្ដាប់បទបង្ហាញនេះហើយយើងដឹងអំពីវិធីដែលធ្វើឲ្យជីវិតយើងរស់នៅបានយូរហើយនឹងការពារនូវភាពចាស់អញ្ចឹងអ្នកអរគ្នាក៏តែមករៀនខ្ញុំវិញ
Seriously, I must say, I feel Asia has the healthiest people in the world because you look at America, 3/4 of America are obese and overweight now, and we know what that does. It creates what's called metabolic syndrome.
ហើយប្រជាជននៅអាមេរិកចំនួន 3/4 ហ្នឹងគឺមាននៅជំងឺធាត់ដែលជំងឺធាត់នេះគេហៅថាជាបណ្ដុំរោគសញ្ញាមេតាបូលិក
Metabolic syndrome leads to what? All degenerative diseases. 85% or more of diseases today are metabolic in their origin. They are not infectious diseases. Maybe only 10 to 15% of disease today, degenerative disease, comes from infectious diseases and pathogenic microorganisms.
ហើយជំងឺធ្ងន់ធ្ងរដែលកើតឡើងនៅលើពិភពលោកបច្ចុប្បន្ននេះគឺភាគច្រើនគឺតកតងទៅនឹងបណ្ដុំរោគសញ្ញាមេតាបូលិកហើយពី10ទៅ15% នៃជំងឺក្នុងពិភពលោកហ្នឹងគឺមិនមែនតកតងទៅនឹងជំងឺឆ្លងទេគឺតកតងទៅនឹងជំងឺមេតាបូលិកនេះ
The thing about this 85% of these metabolic disorders is drugs and surgery really cannot reverse them. They can help and they can slow down the process of degeneration, but they cannot cure them.
ហើយជំងឺមេតាបូលិកនេះគឺពី85% នៃជំងឺនេះគឺមិនអាចព្យាបាលដោយសារការវះកាត់ទេប៉ុន្តែយើងត្រូវប្រើនៅវិធីសាស្ត្រផ្សេងៗទៀតដើម្បីព្យាបាល
And drugs and surgery have been essential for saving lives and improving the quality of life for many, many years now.
ហើយការប្រើប្រាស់ថ្នាំនិងការវះកាត់នោះគឺបានជួយសង្គ្រោះជីវិតមនុស្សជាច្រើននិងត្រូវបានគេប្រើប្រាស់ជាយូរណាស់មកហើយ
But now we feel, and what we want to share is it's time for a change. It's time you took power of your own health again. You take control of it and not give it away, not give your money away for your health. You can take charge and do a lot of this yourself.
ហើយពេលនេះគឺជាពេលយើងត្រូវផ្លាស់ប្ដូរជាពេលដែលយើងមានសិទ្ធិសម្រេចទៅលើសុខភាពរបស់យើងយើងអាចប្រើប្រាស់លុយរបស់យើងដើម្បីទទួលបាននូវសុខភាពល្អ
And with stem cell therapy, like Dr. Campon says and shows, I mean, we're about the same age. I'm 61, he's 65. And we really feel that we feel 40 to 50, and that's how we all want to be, right?
ហើយលោកDr. Campon ក៏បានបង្ហាញហើយពីតកតងទៅនឹង stem cell គាត់បង្ហាញដោយលើកឧទាហរណ៍ពីខ្លួនគាត់ផ្ទាល់ហើយគាត់មានអាយុ65ឆ្នាំហើយខ្ញុំមានអាយុ68ឆ្នាំហើយ
So we're looking at what we call regenerating rather than degenerating.
អ្វីដែលយើងចង់និយាយនៅពេលនេះគឺតកតងទៅនឹងការបង្កើតថ្មីមិនការបង្កើតនៅកោសិកាថ្មីមិនមែនជាការបាត់បង់ទៅវិញនោះទេ
There's a word in English which means degenerates. Many of you have probably heard it, and those are people that you don't want to associate with, right?
ហើយពាក្យជាភាសាអង់គ្លេសដែលហៅថា regenerate ការបាត់បង់នោះគឺជាពាក្យមួយដែលអ្នកទាំងអស់គ្នានៅទីនេះមិនចង់ឮមែនទេ
So we'll start a new word for us. How about if we're called regenerates?
អញ្ចឹងយើងនឹងចាប់ផ្ដើមដោយប្រើនៅពាក្យមួយដែលយើងហៅថាការបង្កើតជាថ្មី
And I hope when Dr. Campon comes back, what do you say, 1 year or 5 years? Maybe sooner than that. 5 years comes back and he looks 10 years younger. I hope when we come back that you all also take this knowledge and utilize it and reverse your own aging.
ហើយលោកDr. Campon បាននិយាយក្នុងរយៈពេល5ឆ្នាំហ្នឹងគឺគាត់ប្រើប្រាស់បច្ចេកវិទ្យា stem cell គឺគាត់ក្មេងជាងមុនដល់10ឆ្នាំហើយខ្ញុំជឿជាក់ថាអ្នកអស់គ្នាទីនេះក៏អាចប្រើប្រាស់នៅវិធីសាស្ត្របែបនេះបានផងដែរ
And Dr. Campon did such a great presentation on stem cells prior to me, so there's not a lot I can say that he hasn't said already. And I had originally prepared this presentation for physicians and scientists because I thought we were presenting them to hospitals. When I heard it was going to be all of us coming, I had to shift it a little bit, so I hope I don't bore some or others in this process.
ហើយលោកDr. Campon នឹងបានធ្វើបទបង្ហាញដូចហើយតើតើទៅនឹង stem cell ដែលបទបង្ហាញនេះគឺគួរឲ្យចាប់អារម្មណ៍មែនតើហើយខ្ញុំគិតថាបទបង្ហាញដែលខ្ញុំបានបង្កើតមកនេះគឺខ្ញុំបង្កើតឡើងសម្រាប់គ្រូពេទ្យឬក៏អ្នកធ្វើការគ្រូពេទ្យព្យាបាលនៅមន្ទីរពេទ្យប៉ុន្តែខ្ញុំនឹងព្យាយាមប្រើប្រាស់ពាក្យពេចន៍ហើយនឹងកាត់បន្ថយកុំឲ្យអ្នកទាំងអស់គ្នានៅទីនេះមានការធុញទ្រាន់ចំពោះបទបង្ហាញរបស់ខ្ញុំ
So can we change the lights so we can see? How do we control the lights? Does anyone know?
ta nên ông nên đừng ta dân ai thường mới làm bay cột rong lửa slide đi mà.
Okay, regen stem. That's all about regeneration of the body. What you need to figure out and know about stem cells, it's what's within you. You can heal yourself. It's not going to be necessary in the future to use drugs, we hope, to have surgeries. We want to be able to come to that point where we can heal ourselves from within. We can take our own stem cells that are within us to regenerate our bodies with the knowledge that we're accumulating now in our research.
Hai việc là stem cell này cứ chia việc mũi để dân ai chia ban khuôn môi dân bàn cứ dân tiên dọc stem cell bị không khuôn bao dân một chia ban khuôn môi dân mình men dọc mình men pra nắng nó có pra ca về cả này hai ở trong đoạn này stem cell này cứ chia ca sợi chia mũi đại chuyện mình được dưỡng cùng phong tài với ca sợi chia nó về bắt chọn này.
And what Dr. Campon is doing is so revolutionary, what he's done. He has the experience. That's what's key. There's a lot of stem cell therapy going on out there. And you need to be very cautious because a lot of it's hype. And a lot of it's people who are just trying to capitalize on this. So if you do choose stem cell therapy, go to those who really have the expertise, the knowledge, and the research behind them to show that it's safe as well as effective.
Hai lô Dr. Campon nước bằng hai em vi ca plug đôi với em thông ta mình dẹp bạch chia stem cell này hai nhà từng ở kia nằm ở trong slide đông bạch chia ní được ở kia ra từ đó nẹt ra chụp ní để sao tại miền bạch chia ní miền mình chỉ ra đẹp chia dâm tiền dọc pha bạch bạch chia ní được nên nẹt ra từ đó nẹt chụp ní đầm bay pra bạch chia ní.
And some of what I'm going to be sharing with you today is very revolutionary and breakthroughs in modern medicine, which is going to change the whole paradigm of how we approach health today.
Vậy được khi mình trai được đấy, nè học này bênนี้cứ chụp cáp lắp đôi mua được thông, cứ được biết để dương mình lắp đôi nơi phải trai bị chia với chữ sắc, cầm nứt không ra kết vì phải trai bị chia với chữ sắc không phải bắt chụp bọn này.
Imagine a world where healthcare is truly defined by health and not disease and industry profiteering.
สมัยไทยพิภพโลกยังนี่คือเน้นการไทยตอนสุขภาพคือมนุษย์ต้องไปในด้านสุขภาพให้มันเมียนแนะนำมันเนี่ยดับชียืมตีนยกพอประหยัดปีวิสัยสุขภาพอีกบ้านเต็ม
Drug companies are making, pharmaceutical drug companies, as I mentioned, are helping so many people. They're making trillions of dollars doing so. Maybe they should be paying us to take their drugs.
ให้เมียนกรมมันจะจ้าแต่บ้านผลิตน้ำให้กินลูกอายุไหนตัวบ้านเลยรอยเย็นหรือแรง
The leading causes of death today, and this is from USA, but it's predominant around the world. You're looking at heart disease. Iatrogenic illnesses is now #2 in the United States. That is a result of the reactions and the side effects from many drugs and also diseases that individuals take on while they're in the hospital.
ให้นี่คือเชียร์มูลให้ได้ปัญหามนุษย์นักเดินสารอเมริกจมูกแบบโดนคือจับหนักขนาดม้วยให้จมูกไอโอโทรเจนิกได้จมูกบรรดาโนปีปฏิการขนาดจับหนักขนาดปี
Cancer, stroke, and diabetes.
ได้จมูกฮาริจมูกได้ใส่เชื้อพวกบ้านนั่นจมูกถึงโนไป
This is from the Cardiovascular Research Institute of America.
นี่คือจากการศึกษาเชื้อในสหรัฐอเมริก
This was actually back in 2000. This study was done, so it's currently it's much more. But look at this last fact here, which is one death every 33 seconds from cardiovascular disease. Every 33 seconds in America, somebody just kills over from heart disease.
ให้นี่จากการศึกษาเชื้อมั่วในทั่วโลกในครั้งชั้นปีปอนคือทางในเรื่องว่า3 ใบสกอง3 ใบวินิตีนั่นคือมีมนุษย์เนี่ยสลับและสารจมูกสายเชื้อแบบโดนในสหรัฐอเมริก
Dr. Campon just told me this morning in Thailand it's 1 every 10 minutes. So you just think of that. You could lose somebody close to you. They could be one of those every 10 minutes or every 33 seconds. We have to teach people how to change this in their own life.
ให้ดร.คำพรนักบันปราบยมกับไปประเมินแทนในประเทศไทยนี่คือมันครองอย่าไปดำในที่เป็นมนุษย์สลับดาวซาลจมูกนี่จังยังแต่เป็นการปรับโดมันอาจเอามัดเพี้ยหรือก็มนุษย์จิตติสลายบางอย่างบัดบ้องครองอย่าไป3 ใบวินิตีหรือก็ครองอย่าไปดำในที่ใบมิเต
This is a very sad fact for all you parents out there and those to be parents. It says CNN did this study, and this was endorsed by the United Nations, to show that 1 out of every 3 children may soon be born with childhood diabetes. They do not have a chance.
ហើយនេះគឺជាការសិក្សាស្រាវជ្រាវដោយសហរដ្ឋអាមេរិកជាពិសេសពុកម្ដាយក៏តែមានការយល់ដឹងពីបញ្ហានេះគឺថាគេរកឃើញថាអង្គការសហប្រជាជាតិបានបង្កើតថានៅក្នុងសម្រាប់ក្មេង3នាក់ដែលកើតមានក្មេងម្នាក់នឹងកើតនៅជំងឺទឹកនោមផ្អែមនៅក្នុងពេលអនាគត
Imagine a world where disease is treated through actual self-healing versus a lifelong dependence on drugs, where a teenage boy with childhood diabetes can regenerate his pancreas with stem cells and live a healthy lifestyle and avoid dependence on insulin for the rest of his life, and eventually die of degenerative disease.
ហើយសូមសម័យថាពិភពលោកហ្នឹងគឺជំងឺគ្រប់យ៉ាងយើងអាចព្យាបាលបានដោយខ្លួនយើងហើយយើងមិនបាច់ពឹងផ្អែកទៅលើថ្នាំហើយក្មេងជំទង់សម័យថាមានក្មេងជំទង់ប្រុសម្នាក់ដែលកើតជំងឺទឹកនោមផ្អែមគាត់អាចបង្កើតនៅរំពេនៅក្នុងខ្លួនរបស់គាត់ឡើងវិញហើយគាត់មិនអាចចាំបាច់ពឹងផ្អែកលើការចាក់អង់ស៊ូលីនឬក៏ស្លាប់ដោយជំងឺអាក្រក់ផ្សេងទៀតទេ
We are facing a time of unprecedented challenge. Why do we need stem cells? Why do we need to change our approach to healthcare today? One of the main reasons is climate change. We all believe in climate change, right?
យើងចង់ផ្លាស់ប្ដូរជីវិតរបស់យើងហើយអីក៏យើងត្រូវការប្រើប្រាស់ stem cell មូលហេតុមួយនោះគឺទាក់ទងទៅនឹងការបម្រែបម្រួលអាកាសធាតុ
Increased population and disease. We're looking at a degradation of our ecosystems from toxic metals and chemicals. And you just heard how serious. Toxic metals could be probably one of the main factors in most degenerative disease today. So we've got to get that out of our system.
ហើយការកើនឡើងនៃចំនួនជាតិជននិងការកើនឡើងនៃជំងឺផ្លែកៗការធ្វើឲ្យខូចខាតនៅប្រព័ន្ធអេកូសាសការបំពុលដោយសារធាតុជាតិដែកដែលការបំពុលដោយសារធាតុជាតិដែកនេះអាចបំផ្លាញសរីរាង្គមួយចំនួននៅក្នុងខ្លួនរបស់យើង
In fact, with toxic metals, it's been shown now, we're all cells, right? We have billions and billions of cells. We're constantly dying and regenerating. They've shown that toxic metals actually block the enzymatic processes inside the cell so that it cannot replicate, it cannot function properly.
ហើយសារធាតុពុលសារធាតុដែកនេះគឺវាធ្វើឲ្យប៉ះពាល់ដល់កោសិការបស់យើងដោយសារកោសិកាយើងធម្មតាអាចធ្វើការបំបែកខ្លួនបាននិងបង្កើតជាថ្មីជារៀងរាល់ថ្ងៃនៅពេលដែលប៉ះទៅនឹងសារធាតុនេះវាទៅប្លុកនិងមិនអាចឲ្យសារពាង្គកាយកោសិការបស់យើងបំបែកខ្លួនបានទេ
There's too much processed non-nutritionist food out there. I mean, look, you have one of the best foods in the world in good wholesome rice. And what do we do to it? We take all the good vitamins out of it and the fibers out of it and give it back to the person. I mean, it's nothing but an empty carbohydrate.
ហើយយើងមានការដាំដុះនឹងមានដំណាំចិញ្ចឹមដែលមានសារៈសំខាន់សម្រាប់សុខភាពដូចជា fiber ជាច្រើនយើងគួរតែផ្ដល់នៅសារធាតុទាំងអស់នេះទៅកាន់មនុស្ស
And then greater dependence on pharmaceutical drugs and chemicals that destroy our internal health. It's all about the milieu, which is our inside ecosystem. We are an microcosm of a macrocosm, right? There's no separation between us and our environment. It's one and the same. What's going on outside is going to affect us on the inside and vice versa.
យើងគឺជាផ្នែកមួយនៃប្រព័ន្ធអេកូសាសនៅក្នុងបរិស្ថានអញ្ចឹងបើសិនជាបរិស្ថានយើងមានបញ្ហានោះខ្លួនយើងក៏មានបញ្ហាដែរ
So imagine a life force of infinite capacity that has been regenerating and healing all living creatures on this planet since the beginning of time. You know what that was? That primordial soup was probably primordial stem cells, right?
ហើយអ្នកទាំងអស់គ្នាសម័យថាវាមានកម្លាំងដ៏ពិសេសមួយដែលមានសមត្ថភាពអាចបង្កើតនិងព្យាបាលនៅរាល់ភាវៈរស់នៅលើផែនដីទាំងអស់ចាប់ផ្ដើមដោយគិតពី stem cell
We now have the capability of healing every degenerative disease, whether it's heart disease, diabetes, whatever it may be, with stem cells.
ឥឡូវនេះយើងបានមានលទ្ធភាពក្នុងការព្យាបាលនៅជំងឺធ្ងន់ធ្ងរមួយចំនួនដូចជាជំងឺបេះដូងជំងឺទឹកនោមផ្អែមនិងជំងឺផ្សេងៗជាដើម
And it's happening now.
ហើយឥឡូវនេះគឺយើងពិតជាអាចព្យាបាលបានមែន
So let's take a look at this miraculous life force. What are stem cells? Stem cells are cells that can make more themselves. potentially unlimited regeneration.
Ta stem cell nó cứ chiều vậy tới stem cell cứ chiều cao sự cả để ai bằng bài khuôn viên những ai bằng các khuôn viên tràn ban rồi bằng
Every part of your body and brain are made from stem cells.
Hai phần chỉ tràn ở lơ riêng cái bao giờ một phần xem sinh tiết cứ bằng các láng pi stem cell.
Whether you're looking at the liver, the organs, the bones, the glands, the skin, whatever may be your hair, everything has to have stem cells to recreate itself.
Sau một căn phlang, một căn trăng ở bao giờ, một căn bay ở bao giờ, cứ có pin xem sinh tiết. Tiếng anh cứ thay cái là stem cell là bay bằng các chỉ thôi.
The characteristics of all stem cells is self-renewal or proliferation, which means making many thousands from one.
Hay lặng nặng xe đã bỏ stem cell nó cứ về ai bằng bài khuôn viên ban được khuôn ấy, hay nâng ai bằng các khuôn ban tra mình tên rock mờn.
The great thing about stem cells too is they all have this brain. You know, we call it it's the cytokine of the stem cell. They know where to go. They know what part of your body needs them. And you have what's inside you called your innate wisdom, which knows how to use those stem cells and where they should go for the most benefit.
Hay ở quay đa bị sai sầm nhập stem cell nó cứ stem cell nó chỉ miếng cốt ban chẳng stem cell nó cứ ai đăng thả ta nó này nên nó để đến khai với lại tra về chân với trong từ chút chớ từ bạc bơ lúc này nụ.
We're pretty smart, aren't we? Even if we don't realize it.
Stem cell chán nó bên này hay giờ mình đang ở bên chán chẳng đấy bên này.
So don't ever call yourself stupid or dumb, because then your brain starts thinking that, right? You are what you think.
Niệm ai thật luôn anh là muốn bán này lấy nó cứ ở đây nó còn bao cái đây dùng pi dùng stem cell nữa.
As I said, we're made up of billions of cells. Even the brain regenerates itself. They did a study at Princeton to show, I mean, many times they say, oh, the brain, once you've got so many cells in there, that's it. It's not true. They've shown quite differently that the brain can regenerate itself.
Hai stem cell nó cứ bị ai bằng máy khuôn ban trở nên bị không bị cao ska thầm nà hay xong bây giờ cao ska của các bạn có ai bằng cát ban chỉ thay món này.
Now some stem cells, they stay what they basically call immature. They're sitting in there and they're waiting to do something.
Hai cao ska mới chỉ nói cái hai là chỉ cao ska là mình toàn bên vây cao ska ở ní nữa cứ chỉ cao ska là để trong việc khuôn là bay thua bảy mùi.
And then when they're activated, they can come out of almost a hibernation. Then they can start functioning and become what you need them most to be.
Please don't make noise. I'm sorry. Sleep snack.
Those are stem cells in action.
Hai sầm rạp stem cell là pin vây nó cứ ai cho được sao là viêm cai bò dần bán ai cho được cam này sinh bán.
This just shows from one fertilized egg, which is your source. This is how you were formed, right? From one fertilized egg, thanks to our mama. People always ask me, where do I come? Where are you from? I always say, my mama.
Dân mới như là sợi muối, hay sợi ní cứ ai bằng bài khuôn ta chỉ cao thì trơn.
But I just want to show that from one stem cell you can form every part of your body.
Hay dân khỏi là trong mình chạy tha. Vì dân mình stem cell tại mỗi ta dân ai bằng cát chiều này xem tiết nó không khuôn là bao dân bằng.
Now these are the broad categories of stem cells. We're looking at embryonic, which are pluripotent, which basically means they develop into all the new tissues in the embryo as well as generate new tissue, repair, replace. Then you have organ-based body cell, I don't know where that line came from, which basically are your organs that you can take these stem cells from and use them, grow them in culture by somebody who knows what they're doing, and reintroduce them back into the body to regenerate your own organs and glands.
Hai ní cứ chưa chấm nát nè, đó là bao stem cell thì mỗi cứ stem cell là do trên bị on bị giống, stem cell này cứ ai một máy khuôn thì chia lì cả mấy, để mà bị on bị giống mỗi, hai cả đôi chia bằng cát để chia lì cả mấy chút rồi coi chừng luôn là cao gì càng.
And of course, those of us who like to look good and look young forever, these can be used also for the skin and anti-aging.
Hai sầm rạp stem cell ní có những ai pra ban đấy bằng sinh nhẹ trong nên trong phần trang là hiệp cha rồi còn trong là bài riêng là sạch.
Many people, or mothers and children, save their own umbilical cord because that can be used as well. And as we mentioned earlier too, your own teeth can be saved to be used for stem cells.
Hai sầm đẹp đây tôi sầm lại cốt, sau bây giờ tông sốc tin cho stem cell đi bàn phòng này, hai đôi dương bàn đơn cho mình dạy bị muốn chất thứ hai dương ai tin cho stem cell bị mình ở bàn này.
Now when you look at this, how life begins, one human embryonic stem cell creates 60 trillion working cells. One cell can create that many cells in your body. It's phenomenal, isn't it?
Lấy xong cả lệnh mơ lúc này, ta chỉ vật chất ngay chấp đang ở Việt Nam. Cao sĩ ca áo bị dối tích ở bao mình đúng, miên tại môi phần nọ. Ta ai bằng bài khuôn chứ cao sĩ ca mang từ lo từ học tập quan liên cao sĩ ca.
This is just an embryonic stem cell from a mouse.
Anh đi cứ chỉ rụt thiệp cao stem cell để ban opi cái nào muối.
And what are adult stem cells? Let's look at that. Adult stem cells help you heal. They are cells found in postnatal tissue, placenta, that can yield only the specialized cell types of the tissue from which they originated. For instance, if somebody has diabetes, you would need to take pancreas to feed the pancreas. If you need to regenerate the kidney, you take kidney cells to feed the kidney.
Hai đứa cứ chia ở này đến nhiều vì stem cell tại bên với stem cell tại bên với những ai chui chia ba những bàn hai stem cell thì có những ai đâu khơi được bàn một vì tàu sọc để ai thì chui là này xem bán hai chuyện bữa sáng dân trong ban bằng cao nơi cao dịch ca nơi đồng bé nhưng cô thì giờ cao dịch ca bị đồng bé một đồng.
And I'm going to skip the rest of this because I don't think we need to get so technical. Dr. Campong covered most of it, but just remember there are different types. There's hematopoietic, there's mesenchymal, there's umbilical cord stem cells found in amniotic fluid. There's so many different sources. Every part of your body, even the hair follicles, could be taken now to regenerate a part of your body and brain.
Lúc đó tôi khám phá ban gì môi trường này không ấy tại con thành stem cell khi mà trong gì to thực tế thế được sao tại vì mình lặng nặng chạy tên họ dùng việc rọt trút theo vì mình stem cell đôi chia hematopoietic stem cell mesenchymal stem cell nâng stem cell là ban opi đông sốc nâng stem cell là ban opi amniotic fluid.
Now this is very interesting here. Most people are astonished by it. The principles of the giant tree versus aging. Some of the giant trees can survive for over a few thousand years. I mean, you can imagine if all humans lived that long. And look at the sea turtles, the giant sea turtles. They can live hundreds of years. Why is this? Basically, whereas the SE ratio in humans starts to decline after 4 months, every cell in this tree is an adult stem cell.
This is the real one of the Khi mình chơi hay ai có đang chơi thông thốt ai luôn nơi ban rộng rồi chứ ném. Nên là sao là đang chơi thì có nít từ miền nơi stem cell, miền nơi stem cell chỉ cho nào. Trong này mình đối với mấy cái bạn bong là stem cell đi, ta mình nơi không có phần tập bị ban giảm về buôn khai, cho bị buôn khai tới stem cell chứ cứ ban thôi cho chỉ lục nào.
I've got an interesting story to tell. My mentor, who was the head of our holistic medical school. He's twice my age now. He's 119 years old. Well, he's almost twice my age. 119 years young.
Trong biên rừng ngôi đời cô chạp ở đó trong cái này ở khía cứ cừu bọc nhau. Còn miền là dùng xong tập đi đó thì khi mấy con cái miền là dùng rồi đập một năm. Còn chỉ cừu đã bằng miền nơi ham chơi lại với chứ sao?
20 years ago, he developed this product that he actually would get from the sea turtle, the ancient sea turtle sperm. And take that and extract these stem cells out of it. At that time, I didn't realize that he was getting the stem cells. He is now 119 years of age, and he and his wife both claim that they have sex at least once a day.
Con nước bạn ăn thay cả vì một thời gian muốn con bạn vô stem cell một vì sperm ở con. Hai con bạn vậy tha con nó chỉ mỗi nơi bảo con bảo con cứ bao chỉ con miên ở dục mà nó nằm buồn sang cả nó rồi con đây tại room pet chẳng hạn nó con một ngày đòn.
And he looks maybe 65 or 70. What 60? Most people 65 or 70 looks like. Not Dr. Campong, you know, but the others. And he feels it. And that to me is a living representation of what stem cells can do.
Hai con mơ tới đôi chị mẹ ở dục thầm tại học 15 năm rồi có 70 năm đôi chị lột Dr. Campong chẳng cứ miền Bắc mấy. Hai mẹ phim đi cứ chịu thì ho mỗi chạy sang này phim trong bằng hai đôi này từng học nè.
Okay, you can see here this is just a graph showing what happens with our stem cells. First 4 months, all cells in the fetus are stem cells. Okay, by the newborn baby, few stem cells in every 10,000, teenagers 1 stem cell in every 100,000, 50 years old, 500,000 to 1 million. With old age, almost all stem cells are in hibernation, and we have to do what we can to activate it and wake them up, right?
Haiនេះគឺជា graph ដែលខ្ញុំចង់បង្ហាញទៅទៅនឹង stem cell នៅក្នុងរយៈពេល4ខែដំបូងនៅក្នុងពោះគឺយើងមានកោសិការបស់យើងទាំងអស់គឺជា stem cell ប៉ុន្តែសម្រាប់ក្មេងដែលកើតមកគឺ stem cell នឹងថយចុះអស់10000កោសិកាហើយសម្រាប់មនុស្សវ័យជំទង់គឺ stem cell នឹងថយចុះអស់100,000សម្រាប់មនុស្សដែលមានអាយុ50ឆ្នាំ stem cell នឹងគឺថយចុះអស់50,000ទៅ1លានហើយសម្រាប់មនុស្សវ័យចំណាស់វិញគឺយើងត្រូវការចាក់ stem cell បន្ថែមទៀត
And you're never too old to regenerate. What the man I just mentioned, Dr. Patcham, he's a prime example.
ហើយយើងអាចប្រើប្រាស់ stem cell នេះមិនដោយមិនគិតថាយើងមានអាយុប្រហែលទេអាចប្រើប្រាស់បានទាំងអស់គ្នា
So what are the function of adult stem cells? We're looking at replace old cells, repair those, regenerate new ones, restore them, regress cancer, and reverse aging.
នេះគឺជាមុខងាររបស់ stem cell ដែលពេញវ័យគឺទី1គឺអាចជំនួសនៅកោសិកាជួសជុលនៅកោសិកាបង្កើតនៅកោសិកាបំពេញនៅកោសិកានិងអាចការពារប្រឆាំងនឹងមហារីកជាបានមហារីកនិងធ្វើឲ្យយើងមានអាយុក្មេងជាងវ័យ
Adult stem cells are obtained in a variety of ways. They can come from embryonic, they can come from fetus, or they can come from the adult.
ហើយ adult stem cell ដែលពេញវ័យនេះគឺយើងអាចយកបានដោយប្រើវិធីផ្សេងៗគ្នាអាចយកពីអមយងអាចយកពីទារកឬក៏អាចយកពីមនុស្សពេញវ័យ
And of course we also talked about children's teeth, which I would recommend you collect every single one of. Be the tooth fairy. I mean that's what this was all about. I got today is do y'all have the tooth fairy here? In America, every time a child loses a tooth, they're supposed to put it under their pillow at night, and a tooth fairy comes and leaves like $1 or 50 cents, whatever it may be. So the child can't wait to lose its, its initial teeth, so that it'll get that money the next day. But it dawned on me, here it is. They should have been taken. Maybe this tooth fairy has taken all those teeth somewhere and stashed them. There's an incredible reservoir of baby teeth somewhere.
ហើយខ្ញុំចង់ប្រកាសអស់ទៀតថាដូចជាយើងទៅបាននិយាយកាលពីព្រឹកមិញអញ្ចឹងតើតងទៅនឹងប្រយោជន៍ការទាញយក stem cell ពីថ្មិញរបស់កុមារអញ្ចឹងនៅសហរដ្ឋអាមេរិកគឺគេមានរឿងរ៉ាវមួយថាមានទេវតាមួយដែលប្រមូលនៅថ្មិញពីកុមារទាំងអស់នេះហើយកុមារទាំងអស់នេះពេលដាក់ថ្មិញនឹងដាក់ថ្មិញនៅក្រោមខ្នើយដែលជឿជាក់ថាទេវតានឹងឲ្យលុយដូចជា50សេនឬក៏$1សម្រាប់ថ្មិញនេះអញ្ចឹងយើងគួរតែរកទេវតានឹងដើម្បីមើលថាគាត់បានប្រមូលថ្មិញនឹងទុកដើម្បីយក stem cell
This is just to show all the different locations, and there's so many more that we've even heard about today. The brain, the liver, the blood vessels, pancreas, epithelia of the skin, bone marrow, the digestive system, skeletal muscle, lungs, cornea, retina, teeth, fat. Practically everything can be utilized, right? If somebody has the proper knowledge to do so.
ហើយនេះគឺជាកន្លែងដែលយើងអាចទាញយក stem cell ដែលពេញវ័យបានមាននៅខួរក្បាលមាននៅខួរឆ្អឹងថ្លើមមាននៅក្នុងសរសៃឈាមមាននៅក្នុងនំពេងកោសិកាស្បែកពីរទៅយ៉ាងឬក៏មាននៅក្នុងភ្នែកសួតសាច់ដុំឬក៏មាននៅក្នុងប្រដាប់រំលាយអាហារឬក៏នៅក្នុងខួរឆ្អឹង
This is just another chart that shows all the different potential sources.
ហើយនេះគឺជារូបភាពដែលបង្ហាញអំពីកន្លែងផ្សេងៗទៀតដែលយើងអាចទាញយក stem cell បានផងដែរ
So there are many sources. You can use your own, which Dr. talked about earlier with the autologous, or you can use allogenic. There's donors out there. The thing that you need to understand about donors is they go through a complete battery of tests to make sure they have no disease, no contagious disease and all of that, but they still cannot be 100% safe.
ហើយការពីព្រឹកមិញយើងបាននិយាយមកហើយអំពីប្រភពក្នុងការទាញយក stem cell ដូចជាប្រភពទី1គឺ autologous ដែលយើងទាញយកពីខ្លួនរបស់យើងនិងប្រើប្រាស់សម្រាប់ខ្លួនយើងនិងប្រភពផ្សេងៗទៀតដែលទាញយកមកពីអ្នកដទៃឬក៏ទាញយកមកពីសត្វយើងទាំងអស់គ្នាត្រូវដឹងថាវាមិនមានប្រសិទ្ធភាពមិនមានសុវត្ថិភាព 100% ទេហើយពេលដែលគេទាញយក stem cell ហ្នឹងគេនឹងយកទៅកម្ចាត់មេរោគសម្រាប់មេរោគចោលប៉ុន្តែ วิธีนี้ตัวใบจีปราวิธีนี้ก็ได้ก็วิมันมีสมรรถเพียบร้อยทองได้
And of course, if you can get them from your own family, your body is going to reject it much less and accept it because it recognizes it.
ให้วิธีนั้นก็ยังอาจจะ stem cell ปีสมาชิกครัวซาบอกยังเพราะไอ้เรื่องกายยังนั่งมันประชันแต่นั่ง stem cell นี่เองหรือก็ประชันติดตัวเพราะเรื่องกายบอกยังนั่งติดตัวจะ stem cell นี่
The donor self, we've talked about the many different sources: bone marrow, tissue, blood, tooth, fat, all of those different sources.
ให้เจ้าบอลเนี่ยได้ตีนจะ stem cell นี่คือจิตครัวบอกยังเหมือนแล้วครั้งจำนวนได้ยังมันใหญ่โดยให้ทางสเต็มเซลล์ยังไงตีนยกมาปีพนาจิจ้าโดยเฉพาะปีกิลิกาปีเชียมปีโคชอังปีขมิ้นหรือก็ปีคลายในครอบครัวดอกไม้ยืน
And the scientist or the physician can take those and culture them in the lab, but the real key there is not anybody can do this. You have to know specifically how to go about it, both genealogically, genetically, as well as getting everything else matched up perfectly, and to keep them safe and pure for reintroduction back into the body.
ให้เนี่ยวิจัยศาสตร์จิตรานั้นบางเพื่อการศึกษาชนิดที่เรียก stem cell นี่ให้ยังเจอแต่ประกอบทาง stem cell นี่คือตกดักบางเรื่องสมรรถภาพมนหนึ่งจะเป็นโจทย์ที่ขนมครัวดอกไม้ยืน
I visited many labs and stem cell labs in the world, and probably the cleanest I've ever seen is the one that Bio-Eden has down in their research center in Bangkok.
ให้เมียนในมันตีศาสตร์จิตราในจงมีพบโลกได้เพื่อการศึกษาพิสเต็มเซลล์นี่ให้มีมันตีศาสตร์ม้วนในที่กลางบางเกาะได้ขยมมันเคยเนี่ยเพื่อการแตะตัวในสเต็มเซลล์นี่
Now, a small number of hematopoietic stem cells circulate in the bloodstream. These cells have the same properties as bone marrow stem cells and can be used as a substitute.
ให้มีนจำนวนตัดใน stem cell ในบาง stem cell มีชื่อว่า hematopoietic นั้นคือดาวเวียทั่วดำน้ำในขนมจราจรหมอเยิงให้ stem cell ประเภทนี้คือยังไอปลาจำนวนเอาคือมีลักษณะโดย stem cell ในโคจรจังยังไอปลาstem cell นี่คือ stem cell ในขนมโคจรจำนวนขนาดบาง
The wonderful thing about this advancement with stem cell research is it's very painful to take the bone marrow stem cells. ให้การศึกษาศาสตร์ชีนบางให้เคยทางการยก stem cell ปีโคจรดอกเยอะนั่นคือชื่อเหมือนแต่มีการชี้จับคลาเหมือนแต่ And now we have the capability of being able to take the blood, as we showed earlier, and be able to proliferate those, so we can use those in place of bone marrow.
แล้วนี่คือวิจัยศาสตร์นั่นคืออาตีนยก stem cell ปีขนมเชียนดอกเยอะจำนวนที่เจียงการตีนยก stem cell ปีขนมโคจรดอกเยอะมาปลา
Okay, we talked about umbilical cord cells already, and the great thing about it is that you're rejected less often by the host tissue.
ให้ยังอะไรนี่ยังเยี่ยมปี stem cell แต่ยังยกมาปีตอนสอบไว้ให้ stem cell แต่ยกมาปีตอนสอบนี่คือมันเซอร์เชียวประชังประมาณเท่ล้วนสำหรับเนี่ยได้เป็นโจน stem cell นี่มันเซอร์มีปฏิกิริยาประชังประมาณเท่
There again, it's another representation of how smart our bodies are. I mean, many times we think, oh, you know, I have a cold, I have the flu, I'm reacting to this or I'm reacting to that, or I have this inflammatory condition, right?
อันนี้บางทีถ้าได้เรียนกายยังคือวิมีนเพียบฉลาดไว้อะให้จิตยังว่ามันยังแต่ออนอาเขายังมีเลยจุดประสายกระดาษคลุนชื่อนี้ชื่อนั้นหรือก็มีปัญหาหรือเรียกอะไรนั่นจัง
That is your body's wisdom. What you're doing is it knows that's a toxin, and what does it want to do? It wants to eliminate it. It wants to get rid of it because it's not supposed to be there. Okay, let's look at a stem cell from a foreign donor, and the body goes, wow, I don't recognize this, you know, these genes are totally different. This is not my DNA. And what mode does it go into? Reject, eliminate, detoxify. So sorry.
อันนี้คือเชียสัตว์บอสารเป็นกายยังแต่เดี๋ยวมันจ้องมันมันทบไปขันกลางยังนึกประชังแต่นั่งมันทบไปขันกลางนี่จังสเต็มเซลล์ยังมันปีเนี่ยตัวที่ได้บริจาคนี่คือเดี๋ยวไปได้จะโจรขนมครุนเยอะคือสารเป็นกายยังนึกประชังหรือการนั่งสเต็มเซลล์นี่เพราะถ้ายังมันสกอร์วิจัยประเภทใดมีแสงของนี้หรือก็ประเภทใดมี DNA เซนค์นี้
And we mentioned this obtaining stem cells from the skin, and of course that can be used for burn victims and things of that nature. But a lot of this too is taken from the hair follicles, which gives a great future, which we saw today with the mouse, In fact, but you know, for taking stem cells and growing hair again from the hair follicle. But there's one thing I would change there. Instead of taking the black mouse and converting it to white hair, I would take a white mouse and convert it to black hair, right?
Haiនេះគឺជា stem cell ដែលយើងអាចទាញយកពីជាការស្បែកយើងហើយខ្ញុំក៏បាននិយាយឲ្យតកតងទៅនឹង stem cell នឹងអាចជាបានជំងឺជ្រុះសក់បានហើយបច្ចុប្បន្ននេះគឺយើងអាចទាញយក stem cell ពីឫសរបស់សក់មកជាបានដែលអាចជាបានជំងឺជ្រុះសក់ឬក៏ជំងឺទំពេកបាន
And you can do a lot of that from the inside out, which I'm going to show you shortly with this oral stem cell form that we've created.
ហើយបន្តិចទៀតនេះខ្ញុំនឹងបង្ហាញអ្នកនរគ្នាអំពីទម្រង់ stem cell ដែលយើងបានបង្កើតឡើង
Okay, we've already covered the two stem cells, so I'm just going to pass this.
ដោយសារយើងបាននិយាយរឿងតកតងទៅនឹង stem cell ដែលយកពីថ្មិញហើយខ្ញុំនឹងរំលងនៅចំណុចនេះចោល
Other than say that stem cells from the teeth replicate at a faster rate and for a longer period of time than do stem cells harvested from other tissues of the body. My feeling of this is probably this almost similar, identical, Dr. Camphone could confirm it, as the bone marrow stem cells.
ហើយ stem cell ដែលយកបានពីថ្មិញហ្នឹងគឺវាមានវាអាចបំបែកខ្លួនបានល្អជាង stem cell ដែលយកពីផ្នែកផ្សេងៗទៀតនៃរាងកាយរបស់យើងដោយ Dr. Camphone បាននិយាយកាលពីព្រឹកមិញអញ្ចឹង
You know, just to impress upon you how alive the teeth are, there's a whole science correlating each one of your teeth to a particular part of the body.
ឥឡូវនេះខ្ញុំនឹងបង្ហាញថាតើថ្មិញរបស់យើងការស្ការថ្មិញរបស់យើងមានប្រសិទ្ធភាពប៉ុណ្ណាហ្នឹងគឺគេបានយកថ្មិញហ្នឹងទៅទាញយក stem cell ដើម្បីយកមកការពារសារពាង្គកាយរបស់យើង
And most root canals maintain an encapsulated infection down where they're supposed to have been basically, what should I say, enclosed. So you have a continuous infection going on there. We have been able to correlate those root canals and those underlying infections with a particular part of the body that may be having serious problems.
អញ្ចឹងនៅពេលដែលឫសថ្មិញយើងមានបញ្ហាដោយសារតែឆ្លងមេរោគផ្សេងៗហ្នឹងគឺវាអាចបង្កជាជំងឺផ្សេងៗ
In fact, I knew a doctor one time who used to take people to Mexico and have all their teeth taken out for cancer. Once they did, the pus and the toxins would come out for months. But when all of that was detoxed, their cancer was gone.
ហើយមួយទៀតហ្នឹងគឺជាការសិក្សាសាស្ត្រនៅមេស៊ីកូគឺគេបានដកថ្មិញពីអ្នកជំងឺមហារីកហ្នឹងអស់ហើយនៅពេលដែលគេយកថ្មិញហ្នឹងទៅសម្លាប់មេរោគនៅពេលដែលគេយកមកដាក់មកវិញគឺគេអត់មានមេរោគជាប់នៅលើថ្មិញហ្នឹងទៀតទេ
Are most of you familiar with multiple sclerosis? Multiple sclerosis?
នៅចំណុចនេះខ្ញុំចង់បង្ហាញអ្នកនរគ្នាអំពី multiple sclerosis
Well, we've had patients with multiple sclerosis where we would take the amalgam mercury fillings out of their teeth, which was blocking that nerve flow, that nerve pathway, and their multiple sclerosis would clear within a matter of weeks to months.
Multiple sclerosis ហ្នឹងគឺអាចជួយសម្រាប់អ្នកជំងឺដែលមានបញ្ហានឹងថ្មិញនៅពេលដែលគេយក multiple sclerosis ទៅដាក់ហ្នឹងគឺអ្នកជំងឺហ្នឹងអាចជាក្នុងរយៈពេល1អាទិត្យឬក៏1ខែ
You know, it's very interesting about that too, because not only with multiple sclerosis, but those of you who think that you're drinking diet pop or diet anything, you're looking at one of the most powerful neurotoxins on this planet. It's called NutraSweet, and it's in every diet drink, diet food that you have, and it is a neurotoxin. We've got many people off drinking diet pops, diet whatever. Because anytime it says diet, you know it's bad. You know, then they cut out the fat, which you need, blah blah. But the NutraSweet actually has caused fatalities in children, and we've gotten people off of NutraSweet, and their neurological disorder disappear. That's a lot, huh? NutraSweet's the sweetener, the artificial sweetener. It's a neurotoxin. It actually is a poison. Yeah. Causes major problems, neurological problems, nervous disorders.
ហើយគាត់បានលើកឡើងអំពី NeuroSwiss ដែលគឺជាបញ្ហាមួយដែលកើតឡើងបើសិនជាយើងលេបនៅ NeuroSwiss នេះគឺធ្វើឲ្យយើងមាននៅបញ្ហាទាក់ទងទៅនឹងប្រសាទប្រសាទ
And they also showed with that not only does it not reduce weight, but it actually increases weight because it blocks the metabolic processes and makes people crave more sweets.
hai cái này dân chi riêng mình cho thùng ngón đào mình nhám score nó cứ chung cá cứ thôi mình đúng nó can tại clean score nó trang trình mình tiệt chứ cái này riêng clean chứ cứ dân nhám score thùng ngón như cái can tại can làm này.
This is just to show that I think we're all familiar with bone marrow transplants, right, for leukemia and types of blood disorders.
Hai đi dân bây dân hai bây ca phía ba tại toàn thành khối ăn nâng chủng ngữ môi trường nước để cả làm đôi chi chủng ngữ khoa chiêm rồi hóm leukemia chỉ đàn.
Bone marrow transplants were actually what I feel to be the original stem cell therapy.
Hai vậy để khiêm trong mà hai cái này ở cái nó cứ cam chia ba để pra stem cell.
And look how far we've come from that now. This just shows what happens with the bone marrow transplant and how it affects all the blood cells, the lymphocytes, erythrocytes, platelets, monocytes, basophils, eosinophils, neutrophils. We don't have to get into that other than know that these cells are what run your immunological system of your body as well as the nutrition in your body, the oxygenation of your body, the fighting parasites, all of those.
Hai đi cứ chia lúc theo đang hai pi cộng chia môi trường nước. Đôi chia crop chiêm, đôi chia lymphocyte, đôi chia plaquette, monocyte, basophil, đôi có eosinophil, neutrophil chỉ đạo này cộng chiêm ở đây cứ chui cá pia sấy đứng dưới pi mero xem.
You know, there was a quote by an old master that said, "The life of the flesh is in the blood," and it's true. That's where our stem cells are. You know, that's where all our cells are. That's where we get our nutrition. It all comes down to the cell.
Hai miền Krupet chúng mình nhé, Krupet chúng mình nhé, con gì tại tôn tên là con gì thành trẻ sát chiêm là bộ sát bao nhiêu cứ bông ai thì đều chiêm, chắc chiêm đại chiêm nó không chiêm nó như tông là cao gì cả, chắc stem cell nó cứ miền giả sầm khăn nè, sầm rạp liên khai bao nhiêu.
There's been some great progress in treating spinal cord injuries and paralysis. They're still pretty far away from accomplishing that, but there's been a lot of progress with it.
Hai ca phía ba bộ tại tôn tên là khối chân Phnom, là này cứ cầm bông sắc ở cầu mà ca sắc xa ra chiếu để pra stem cell.
So these are the 5 types of direct implantation of stem cells. There's a heterologous, which that comes from outside, which can have rejection problems, a little more difficult to heal. Autologous, which comes from yourself, less quantity needed, differentiate into specific working cells, so that's of course the best direction to go. Animal stem cells therapy, there's a rejection problem there. Umbilical cord, very beneficial, and embryonic, of course, is as well, but then there's the moral aspect of that, as well as one problem with embryonic, unless somebody's using them who really has the expertise, is they can turn into anything in the body. So they're very hard to control, direct, and specialize them into what you want them to be.
Hai đi cứ chia prepared ca do stem cell, nguyên ra một hết, ca tiên do tim mới tại tôn thành heterologous, để dân ca tiên do pi riêng ca này tới, thì piคือ autologous, để do pi riêng ca này bao nhiêu, hai mươi tiết cứ ca tiên do stem cell bị sát. Mới tiết cứ ca tiên do stem cell bị tôn sắc bảo dưỡng, đại ca tiên do stem cell bị tôn sắc bảo dưỡng cứ viên xã sầm khăn là cứ viên phải giáo bị anh bầm lái thế chia, này xem tiết để riêng ca bảo dưỡng, tại nít tiêm tiên là nẹt chừng niên cho bao lo. Hai mươi tiết cứ ca tiên do stem cell bị ông bị dòng, hai ca tiên do stem cell bị riêng ca đại tây nó cứ anh niên phát triển cam phải chăng bị riêng ca bảo dưỡng, hay ở vậy là nó cứ đại tôn là autologous cứ theo riêng ca bảo dưỡng mình phải chăng này luôn. Stem cellคือบ้านยกมาปีศาจเป็นการบอกยังต่อ
So what I would like to share with you now is some research that we've been doing at Johns Hopkins University, which maybe many of you all have heard of. It's one of the foremost medical schools and research centers in the world.
Vậy để không trong chạy đồng đầy trên một nền ở phía bên này cứ tại tôi thành ca sắc xa xa chia nên mà hai chia lại John Hopkins đã chia mà hai chia lại mỗi đó là bảy bán này bị sát tại tôi thành ca xa chia hai chia nền ở phía lắm môi trường nước square nên mà hai chia lại đi hai.
Been able to use stem cells to repair heart muscle damaged by a heart attack and other heart diseases. These stem cells come from bone marrow, circulating blood, autologous cell from the heart cells themselves. Heart muscle cells, or from donors.
Haiในขนมca sạ bóng này bây giờ sáng nâng cái ban pra stem cell là mới chút chút là cao nơi sạch đông bạch đốm đại rong là cao khối khác đào giờ pi chủng ngữ keo bạch đốm hai nâng là chủng ngữ bạch đốm là tây tiền hai stem cell ở nâng cứ miền bậc phục một pi khối ấn một pi chiếm rồi có ban một pi khuôn dướng ban một pi microcyte rồi có nhẹ bò để chạm xem tiền.
There's been a lot of hype and a lot of publicity about this heart approach with both transplants and through the other processes. But a lot of the efficacy and the success has been very, very limited. Well, I would like to share Dr. Steele's research with you.
Hai ca sát sao chiếu này stem cell nó cứ về miền phiệp sang nhà mình tèn hay phiệp chụp cháy nó có miền cộng nọt này là những trong bằng hai about Dr. Ann Steele that you get to meet me.
And our partner, Dr. Ann Steele, who basically just retired from Johns Hopkins because they were trying to steal all of her work and her research, so now she's wanting, or we're preparing to bring her here, which is very, very exciting.
Hai Dr. Ann Steele cứ chia group page mỗi để thưa ca nơi mà học trường Johns Hopkins ta là đi cột man lên pin học trường này ha để thưa ca sát cha chia đập tốt để kêu gọi toàn hai giờ dừng cơm thành ngày non quát một nơi bảo can tin những ngày nào mùi.
Dr. Steele is the first stem cell researcher in the world to successfully use stem cells in heart transplants and to develop using stem cells for the effective regeneration of the heart from any stage or type of heart disease using stem cell therapy.
Hai Dr. Ann Steele cứ chia nhận xét chứ điều này stem cell đồng bông on lên phục lột để bàn pra stem cell ban chụp cháy nông ca vẽ cắt lọc đồ vẽ đốm đại ban là bằng cát nơi stem cell để pra là không vẽ đốm là miền đầm nặng ca môi trùng nuốn nông sầm lạt lọc đồ vẽ đốm sầm lạt đại trùng ngư đại miền là trùng ngư vẽ đốm đại pra cắt triệu ba stem cell.
Let me reiterate, she's not the only one, okay, but I feel, and we've seen that she is the one who's getting the most consistent, long, withstanding results.
Anh Steph còn mình chỉ nhận chứng minh tay mình nhé, phần tay phim cật thác có cứ chia nhận ra trên hồi chạm được mình nhé để thưa ca là lời sign in ban du trình kê được tụi bạn chốt chơi trang trình kê.
She's received many awards and acknowledgements from the United States government, from the American Heart Association for her work.
Hai Doctor có các bạn Dr. Ann Steele các bạn các Scorpio rồi thay bị ban làm rách nâng các Scorpio mà cũng chúng người bệnh đốm xã rồi làm rách không này.
So that due to the progressive nature of cardiac disease, the potential of utilizing stem cells in a cardiac medicine is either a standalone therapeutic strategy or with current protocols offers a new and powerful treatment choice. Very exciting.
Hay là sao tại lẽ nặng thông chiết nên chúng người bệnh đốm nó cứ dân ta ca ra stem cell nên không ca chia ba chúng người bệnh đốm chỉ mỗi lần ca chia ba là đợt tây tiết đào ao như chúng rơi thì ca chia ba nó xem những tay kia.
This is just a healthy heart.
The
problem with cardiac energy could be congenital, mechanical, metabolic, genotoxic, results in an irreversible loss of heart cells.
Hai môn là haiបញ្ហាដែលកើតឡើងនៅលើបេះដូងយើងមានដោយសារតែមានពីកំណើតដោយសារតែ head-pole mechanic ឬក៏ metabolic ឬក៏ដោយសារតែជាតិពុលផ្សេងៗដែលជាលទ្ធផលធ្វើឲ្យបាត់បង់នៅកោសិកានៅក្នុងបេះដូងរបស់យើង
And this can eventually lead to heart failure.
ហើយអាចធ្វើឲ្យមាននៅបញ្ហាបេះដូងផ្សេងៗទៀត
I won't go into all the different diseases of the heart. I think most people here know that or be bored by it, but there's so many different conditions that this could be applicable for.
ហើយខ្ញុំនឹងមិនបង្ហាញអត់ទេអំពីជំងឺនៅលើ slide នេះគឺដោយសារអ្នកអរគ្នាទីនេះថាជាដឹងហើយពីជំងឺអ្នកខ្លះជួនកាលកើតមកអាចមានជំងឺនេះថែមទៀតផង
So the congenital anomalies, let's get on to this. The old solution would eventually be heart transplantation. We do not feel this is necessary anymore.
Hai vị thị xã vì muốn chắc nông cao triệu baជំងឺបេះដូងនោះគឺការវះកាត់ផ្លាស់ប្ដូរបេះដូងថាវះកាត់បេះដូងមិនតែយើងមិនគិតថាដំណោះស្រាយនេះគឺវាមានប្រសិទ្ធភាពទៀតទេ
The old solution for coronary artery disease and heart attack was usually bypass surgery, but someone would have bypass and maybe they'd have to come back in 2 or 3 months later have another bypass, or in another year have another one. So it's a limited approach.
Haiជំងឺដែលតកតងទៅនឹងអាតេកូរ៉ូណែឬក៏ជំងឺកាំបេដូងហ្នឹងគឺអ្នកជំងឺត្រូវការវះកាត់ម្ដងហើយម្ដងទៀតជាច្រើនដង
Heart lung machine, arrhythmias, tachycardias, implantable defibrillator.
នេះគឺជំងឺតកតងទៅនឹង arrhythmia ឬក៏ tachycardia.
So let's look at the new breakthrough development of stem cell therapy with this.
ឥឡូវនេះសូមកលេចមើលមកកាន់ការព្យាបាលដោយប្រើប្រាស់ stem cell.
Regenerative medicine, alignment with nature to regenerate, replace the dead cells, the damaged cells, and repair.
ការព្យាបាលដោយបន្តកោសិកាគឺជាការព្យាបាលដែលស្របទៅនឹងធម្មជាតិគឺយើងបង្កើតផ្លាស់ប្ដូរនិងជួសជុល
Now, I would like to show you this because this was some of the original research that was performed at All Children's Hospital. I'm sorry.
ហើយនេះគឺជាការខ្ញុំចង់បង្ហាញរូបភាពនេះគឺជាការវះកាត់នៅក្នុងតំបន់វះកាត់បេះដូង
This is Dr. Steele here working with the other heart surgeons.
នេះគឺជារូបភាពរបស់ Dr. Steele ដែលគាត់ធ្វើការជាមួយនឹងវេជ្ជបណ្ឌិតផ្នែកជំនាញបេះដូងផ្សេងៗទៀត
And they initially were doing heart transplants with children at All Children's Hospital, which is a subsidiary of Johns Hopkins.
ហើយនៅក្នុងរូបភាពនេះគាត់កំពុងតែធ្វើការវះកាត់ទៅលើកុមារម្នាក់ដែលជាមន្ទីរពេទ្យកុមារនេះគឺជាផ្នែកមួយនៃមន្ទីរពេទ្យរបស់មហាវិទ្យាល័យ Johns Hopkins.
And what they would do basically when the child was to receive a heart from a heart donor.
ហើយនៅក្នុងចំណុចនេះគឺថាកុមារនេះគឺបានទទួលនៅជំនួយបេះដូងពីអ្នកដែលបរិច្ចាគបេះដូងហ្នឹង
When they received the donor heart, the child would come in, they would take the heart out and put the child on cardiovascular support.
ហើយក្នុងការព្យាបាលហ្នឹងគឺគេនឹងយកបេះដូងរបស់កុមារចេញដោយសារតែបេះដូងត្រូវការធ្វើការព្យាបាលនិងដាក់ចំនួននៃបេះដូងមួយផ្សេងទៀត
They would take the heart muscle cells, extract them from the old heart along with the atrial appendages, just the blood vessels.
ហើយគេនឹងយកនៅកោសិកាសាច់ដុំបេះដូងរបស់អ្នកដែលបរិច្ចាគហ្នឹងហើយនឹងចាក់បញ្ចូលវាទៅតាមខ្សែឈាមមកឲ្យកុមារ
Take them right into the lab and culture and grow them.
ហើយនឹងយកនៅកោសិកាហ្នឹងទៅក្នុងទៅបណ្ដុះទៅក្នុងមន្ទីរពិសោធន៍ដែលបណ្ដុះនៅកោសិកាទាំងអស់នេះ
And when they introduce the new, let's call it an alien heart to the child, they would inject these cells from the old heart into the new heart, and there's very little to no rejection and very, very fast recovery time.
ហើយគេនឹងចាក់នៅកោសិកាថ្មីដែលគេបានកែច្នៃសម្រាប់មេរោគអស់ហើយដែលចាក់ចូលលើកោសិកានេះទៅក្នុងបេះដូងរបស់កុមារហ្នឹងអញ្ចឹងបេះដូងរបស់កុមារហ្នឹងគឺអត់មានប្រតិកម្មតបតទៅនឹងកោសិកាដែលចាក់ចូលថ្មីនេះ
It's gone one stage further now where you don't have to do the transplant. Basically, if there's any type of surgery, you can go in and take the heart muscle cells.
ហើយនេះគឺជាវិធីសាស្ត្រថ្មីក្នុងការព្យាបាលនៅជំងឺបេះដូងដែលយើងមិនចាំបាច់ធ្វើការវះកាត់ផ្លាស់ប្ដូរបេះដូងទេដោយគ្រាន់តែយកកោសិកាបេះដូងពីនរណាម្នាក់មកមួយទៀត
Take it from the peripheral blood.
ដែលយកវាពីសរសៃឈាម peripheral.
And some successes also with donor cells, stem cells.
ហើយអ្នកជំងឺខ្លះក៏មានក៏ទទួលបានជោគជ័យដែរក្នុងការចាក់នៅកោសិកាបេះដូងពីអ្នកបរិច្ចាគដទៃទៀត
And then after culturing them and growing, introduce them back into the body, either directly into the heart or through the blood intravascularly.
ហើយបន្ទាប់ពីយើងបណ្ដុះនៅកោសិកាសាច់ដុំបេះដូងនេះហើយយើងអាចចាក់វាបញ្ចូលដោយផ្ទាល់ទៅក្នុងបេះដូងតែម្ដងឬក៏យើងអាចចាក់តាមសរសៃឈាម
Now, one thing that we have a patent pending on is we've developed what we call an eco-solution, which is a lab culture where we can grow stem cells. The problem before is being able to grow enough of them.
ហើយយើងបានបង្កើតនៅមន្ទីរពិសោធន៍ថ្នាំបណ្ដុះមួយដែលយើងចាត់ទុកវាជាវិធីសាស្ត្រមួយដ៏ល្អនេះហៅថា eco-solution.
What we've been able to do with this all-natural extract from organic Thai rice, it's a polysaccharide, polypeptide, alpha-beta glucan.
ហើយអ្វីដែលយើងអាចធ្វើបានហ្នឹងគឺយើងបណ្ដុះនៅកោសិកាដែលយើងបានមកពីអ្នកដទៃហ្នឹង
Rather than using a chemical cocktail, which basically they use now to enhance the growth of the stem cells.
là ní cái mình pra pra nơi sản thiết kim mỹ đam bay ao stem cell nâng rít lo bàn lươn này.
We can create a proliferative burst and grow thousands of more stem cells than you can with the typical culture for growing stem cells.
Hai dân ai giờ pra pra nơi vị trí mới tiết bạc thôi mình chết để ai ao stem cell nâng rít lo bànอย่างlươn. Là mình bay pra pra nơi sản thiết kim mỹ.
And what Dr. Steele has seen with this culture, it's like feeding a child healthy food compared to feeding it food that are going to make it hyperactive or make them autistic or ADD. The cells have more sense, you know, they're smarter. They know what they need to do and where to go, and they're more effective and more active.
Hai, ní cái chuyện cũng là Dr. Steele còn bạn cần phốt mình trong đó ao nơi của ma nó cao sự ca mỗi để đặt để về để đặt cho được khung luôn nó cao sự ca nó phải chăng tại nơi của ma nó vậy nhỉ? Còn trong đó ao để cao sự ca để đặt cho được khung luôn của ma nó cứ cao sự ca nó ở đằng thang cái này nè đây để cao sự ca nó tới cái này nè để cao sự ca nó tới từ chuột chuột.
One of the keys here, as I mentioned, cells need energy in order to do their work, right? We all need energy. The polysaccharides are basically the carbohydrates, which are pure cell food from this rice extract. And I'm going to show you how we developed an oral formula which includes this eco solution, which can activate and enhance your own stem cells.
Stem cell. Stem cell
This just shows the difference between normal stem cells and our stem cells that we've used in the heart. They're much more alive. This shows how we compare damaged heart tissue here. And also the bowels, repair blood vessels, which is fantastic for PAD. And this just shows undifferentiated and differentiated heart stem cells. We have hundreds of slides showing and demonstrating this, but I'm trying to make it very condensed here, very simple. So we really feel the future of medicine is using the integrated approaches, taking what we know about stem cells, but also teaching people how to take care of themselves, right? I mean, they have to be empowered. We can't give away our power. We have the power to heal ourselves, right? Another interesting thing we discovered with this eco solution, which surprised and blew us all away, is when we took a medulloblastoma tumor, the first treatment with eco solution stopped the growth of the tumor. This is a type of tumor that's very, very difficult to either remove surgically or to reverse. Eco solution stem cell. Capture by the eco solution This is a brain tumor that kills so many children today. Now another exciting thing about this is anybody who gets any type of surgery or any type of incision, burn, cut, abrasion, whatever it might be, say somebody who wasn't at the lecture this afternoon and went in for plastic surgery and got all cut up, you know.
ông chôn được bên ní nó cứ đẹp phát cứ thưa nơi cao ven cát cao sầm phù đã ai nhờ đo là snap để lên một quả dương mềm.
We've now developed a spray that we can spray on that incision, the surgical incision, that will help it heal 3 to 4 times faster with little to no scarring.
Hai là ní phim trong này non ở ní âm pi ca pra spray bánh đại miền ở tục là stem cell về đại dương bánh tới cứ vì thưa admin snap cứ thưa slot snap bắt mình tịnh đó rồi hot đó admin snap.
Okay, I've got about 5 minutes here left because I want to open up for a lot of questions.
Là ní phim sau giả pe pram tí tiết đam bay thưa là bật hai phim trong ao nét ngọc ní bên sầm nua xua chán tục ở ca sầm sầm nua.
But I want to share with you the oral stem cell enhancer that we've developed that everybody in the world should take.
Và ta phim trong là bằng hai anh nét ngọc ní đang làm pi stem cell đại nét ngọc ní là bị phụp lốc nụ thì anh phụp lốc của tại pra.
It's a proprietary blend of 3 ingredients. It's a potent natural organic phytohormone that has abscisic acid in it. You're going to hear more and more about this term, abscisic acid.
Hai ní thì muốn nó cứ tại trong thành năng phytohormone đã chiaประเภทabscisic acid,
which is the powerful supports the stem cell health discovered today. It has the eco solution, the bioavailable cell food.
ได้ជាប្រភេទ stem cell មួយដែលល្អណាស់ដែលប្រភេទ stem cell មួយដែលមានអាចជួយទ្រទ្រង់រាងកាយនិងសុខភាពរបស់យើងបានតែគេបានរកឃើញមកដល់បច្ចុប្បន្ននេះ
And the third ingredient is a powerful extract from chlorella, which is basically called chlorella growth factor because it can stimulate cell growth so exponentially.
ហើយប្រភេទមួយទៀតនោះគឺ chlorella growth ដែលអាចជួយពង្រីកល្បឿននៃការរីកលូតលាស់របស់សារពាង្គកាយយើងបាននិងកោសិកាយើងបាន
So this is where we want to feed our own stem cells, both to wake them up, but also to activate them, to give them the culture to be able to have energy like they would with the eco solution being part of that formulation.
អញ្ចឹងហើយយើងគួរ stem cell នៅក្នុងខ្លួនយើងគួរតែផ្ដល់ថាមពលដល់ stem cell នេះដោយបណ្ដោះវានៅក្នុងថ្នាក់បណ្ដោះដើម្បីផ្ដល់ថាមពលហើយនឹងចាក់បញ្ចូលទៅក្នុងខ្លួនរបស់យើងវិញដើម្បីប្រើ
Quickly, I'm just going to go through some of the benefits. It increases stem cell growth. It can increase CD117, 105, and CD34. Those are all markers for hematopoietic and mesenchymal stem cells. Creates optimal environment for the stem cell growth. Supports a healthy inflammation and immune response, and actually fights free radicals while eliminating toxic metals and chemicals. Repairs, renews, revitalizes all cells in the body, and supports the natural release of adult stem cells, the master cells.
ហើយនេះខ្ញុំចង់បង្ហាញអ្នកនរគ្នាអំពីធាតុផ្សំមួយចំនួនរបស់ stem cell នឹងការបង្កើន stem cell នៅក្នុងខ្លួនរបស់មនុស្សហើយនឹងការបង្កើតនៅ CD117 CD105 និង CD34 ដែលជាអ្នកបង្កើត stem cell នៅក្នុងឈាមហើយសម្រាប់កោសិកា stem cell ទាំងអស់ហើយនឹងការបង្កើតនៅបរិស្ថានមួយដ៏ល្អសម្រាប់ការបំពេញមុខងារហើយនឹងការរីកលូតលាស់របស់ stem cell ហើយនឹង control ដែលវាអាចជួយការការពារការរលាកនិងជួយឲ្យមានការឆ្លើយតបរបស់ប្រព័ន្ធភាពស៊ាំក្នុងរាងកាយរបស់យើងដើម្បីប្រយុទ្ធប្រឆាំងនឹង radical សេរីយើងជួសជុលនិងបង្កើតជាថ្មីនិងបង្កើតជាថ្មីនឹងធ្វើឲ្យកោសិកានៅក្នុងខ្លួនរបស់យើងមានដំណើរការឡើងវិញនិងគ្រប់គ្រងនៅវាជួយទ្រទ្រង់ដល់កោសិកា stem cell ដែលពេញវ័យក្នុងការបញ្ចេញនៃកោសិកា stem cell ដែលពេញវ័យគឺជាកោសិកាមួយដែលអាចរក្សានៅជីវការរបស់យើងដែលបំលែងខ្លួនវាទៅជាកោសិកាថ្មីមួយដែលមានសុខភាពល្អប្រឆាំងនឹងភាពចាស់ជួយថែរក្សាសម្ផស្សនិងអាចបង្ការនៅជំងឺដំណើរការនៃជំងឺផ្សេងៗបាន
So the great thing about what we're doing now is, especially with this oral form, it's affordable and beneficial for all. Everybody can take it, from kids all the way up to the elderly.
ហើយរូបមន្តដែលបង្កើតលើ stem cell គឺថា stem cell នេះគឺមានតម្លៃសមរម្យដែលអាចប្រើប្រាស់ទាំងអស់គ្នាអ្នកទាំងអស់គ្នាអាចប្រើប្រាស់បានកុមារអាចប្រើប្រាស់បានអាចប្រើប្រាស់បានទាំងអស់គ្នាសម្រាប់ទាំងអស់គ្នា
So Dr. Kampong presented all of these possible treatments for stem cell therapy, and there's just a couple of things. One, the anti-aging cosmetic for wrinkles, age spots, old skin. Basically, you can put stem cells in any cosmetic. We're looking at putting it into a night cream, or just at night you put the plant serum on and it just soaks up into your skin. Very easy application.
Hi, Dr. Kampong ក៏គាត់បាននិយាយឲ្យថាពី muốn tại tôi đang ta stem cell đang ai chịu bao nhiêu chủng ngữ vậy bằng khla nhưng xong được chủng mạch mỗi giờ một giấy cứ tại tôi đang capra pan không kêu sòng án mà bây giờ trang thiệp chặt chiên ở dưới rồi chia capi thiệp chiên chuôn capi snam ớt nêu lưỡi máy hay có nâng stem cell đó ai capra pan không ca cam đi bốc nợ vô phòng này dân con này vô mà điệp lơ mốc để ai capi thua spy dân màn ỏ.
So this just shows the market of stem cells and how it's growing today. Let's look at 2005 is about $1 million in the market. Look at 2016, $8.5 billion market we're looking at. I think it's going to be double that with the latest innovations and discoveries with stem cells, it's going to go far beyond that.
Xong mơ một căn tiếp sản của lốp tại tôi đang trong hôm này bằng căn stem cell này không cho bị quan phát cứ rồi ban chủng nôn căn sẽ bằng bờ mình là chiến năm bị quan muối bị quan bằng bờ cứ chủng nôn căn lang chủng địch hay rồi đây năm bị quan là bằng muối nó cứ như bằng băng tha chủng nôn nó cứ căn lang đo bằng bảy chuyện pram cao lên là cao đô lá trong chưa chạy ta chủng nôn nó bằng căn lang lên bị đi tiền.
With this, what's going to happen, there's going to be so many companies wanting to capitalize and profiteer on it, particularly the pharmaceutical companies. We've been approached by dozens of pharmaceutical companies who want to buy our intellectual property and take it over.
Hai công hồn ở dưới Regenerative nó cứ là tập hợp công hồn dưới nó cứ bên đồng ngoài sòng rồng. Hai miền công hồn Phnom chỉ ra để ban tệ tông. Một công hồn ở dưới là mấy tên người sát cam sát bên nhà.
Two problems with that. One is we don't know, we're afraid they'll take it and suppress it. We don't know that they want to, if their intentions are right. The other thing is once they have it and control it, the price is going to be so unimaginable that most people will not be able to afford it. While we're keeping the IP, we'll be able to keep it at an affordable rate for everybody.
Hai vậy đây chỉ cả bây giờ một nhóm nó cứ mình đang thằng kia giờ tập pra nó kia pra đang trong thời đại Việt Nam hai kia pra đừng lộ với những con đồng lại của mình hai chẳng hết nhưng mà ban chi tiêm không ca để xa nơi cầm sập ở nhà để bảo công hôn dương.
So what we do is that was the time where I said to stop exactly 1 hour. I was supposed to play marimba. I was going to do a dance, but sorry, it didn't happen. Anyway, just to finish up, my feeling about it is, if we're not busy living, we're busy dying, right? I mean, every morning I feel we should get up and meditate about what we're going to do that day to improve our life, to enhance our life. You know, not so many of my patients, I practiced for 30-something years, and one of the biggest problems is patients would come in and you say, oh, I'm a diabetic patient, oh, I'm a cancer patient, you know, I have schizophrenia, whatever it may be. And they were plugging that into their consciousness. We need to change the consciousness not only of ourselves, but of the whole world. And this is a paradigm that we can positively influence. Each and every one of you in here has that power to affect so many other people, partially by sharing what you have today and by living it. Improving your own life, eating right, living right, detoxifying. And look what it's going to do for the generations to come. So I feel we're at one of the most exciting precipices, one of the exciting moments in the world where we can change the health and the paradigm of medicine today for human beings, to improve the quality, not just the quantity of life.
Khi mà tôi càng không phải bị sáng như ở nhà về trang năm ấy mình lại chừng người khác đã chỉ là chừng người bảo nhóm phát minh chừng người thực nông ai quạt ban đầu nhóm hay khi mà mình nhiều ra bộ quạt ai plug đôi là plug mà bảo bộ quạt hai đây ở cái này để ban cho room nơi nông cam thì bao nhiêu có chỉ iPhone non nơi cầm nứt thay mấy để trai chu nè là tây tiền ở vậy cứ cái trên mình này ở cái này nhám cho cái price nó là bao nhiêu là bao nhiêu ban trầm tới luôn nơi ban ở trầm tới nó cầm chắc mê đâu trên cái điện thoại bao nhiêu you could chim thi sát để trầm tới.
So let's go change the world cell by cell, but always remember everything comes from within out, right? We are the center of the universe.
Chẳng những ai cái price này bị phục lục bao nhiêu bàn, vậy với cứ cái trên bị luôn là bao nhiêu, cái trên bị không trên là bao nhiêu, hai nơi mình chạm ra từ điện ở kia, dương cứ chim chạm nơi bị phục lục này.
So more power to you. Thank you so much for being a great audience, and I look forward to your questions. So I look forward to seeing you again too when you all look younger, right?
ហើយសូមឲ្យអ្នកនរគ្នាមានកម្លាំងពលំមាំមួនហើយខ្ញុំទុកឱកាសឲ្យអ្នកនរគ្នាដើម្បីសួរសំណួរអ្នកនរគ្នាក៏ជាមានសំណួរច្រើនដែរមែនទេ
Yeah. Okay, we need to bring Dr.
Dr. Campbell.
Okay.
Please come to the stage.
Pass your questions in if you have any more.
We have a question, like 5, 6 questions. This is the first question.
The first question, should I read the question? Yeah. What are the difference between Vita Longa stem cell and other clinic? Stem cell ដែលកាលឡើងនៅ clinic Vita Longa ហ្នឹងគឺខុសពី clinic ដទៃទៀតយ៉ាងម៉េចទៅ
Well, I think maybe Mark can give some additional comments. We are exposed to many stem cell therapy offered by many groups and many companies.
Dr.Mark បានបង្ហាញដោយទៅហើយថាយើងបានប្រើប្រាស់បច្ចេកវិទ្យា stem cell នេះឲ្យរយៈពេលយូរមកហើយនឹងធ្វើការជាមួយ stem cell នេះទោះបីជាមានក្រុមហ៊ុនជាច្រើនឬក៏ clinic ដទៃទៀតកំពុងតែធ្វើការជាមួយ stem cell នេះក៏ដោយ
I am also involved with many companies such as Vita Longa, Asia, and also with this company.
ហើយយើងក៏បានធ្វើការជាមួយក្រុមហ៊ុនជាច្រើនដូចជា Vita Longa,
Bio Eden,
Bio Eden ហើយនិងក្រុមហ៊ុនរបស់លោក Dr.Mark គឺក្រុមហ៊ុន Regenerative.
Each of them have different source of stem cell, and each different stem cell has different properties. Therefore, in order to be fair to everyone, before you are going to use any stem cell product, check about the origin of the stem cell first. ហើយក្រុមហ៊ុន stem cell ទាំងអស់នេះគឺមានលក្ខណៈពិសេសក្នុងការបង្កើត stem cell រៀងៗខ្លួនអញ្ចឹងមុននឹងយើងប្រើប្រាស់នៅ stem cell ហ្នឹងយើងគួរមើលពីប្រភពតើ stem cell ហ្នឹងយកចេញមកពីប្រភពណា I cannot claim that our companies are the best, but I can claim that we are trying to be one of the best. ខ្ញុំមិនអាចអះអាងបានថាក្រុមហ៊ុនខ្ញុំគឺជាក្រុមហ៊ុនដែលល្អបំផុតទេតែខ្ញុំអាចអះអាងបានថាយើងកំពុងតែព្យាយាមដើម្បីខ្លាចខ្លួនជាក្រុមហ៊ុនមួយដែលល្អបំផុត And last but not least, you as a patient are the best doctors for yourself. So even with the technology like stem cell, you must learn to change for yourself. First about your thought process. ហើយក្នុងនាមជាអ្នកជំងឺឬក៏គ្រូពេទ្យក៏ដោយយើងគួរតែយល់ដឹងបានច្រើនពី stem cell នេះអ្វីដែលយើងគួរតែផ្លាស់ប្ដូរដំបូងនោះគឺផ្នែកកំណត់របស់យើងខ្លួនឯងផ្ទាល់ And the way you live, if you want to do stem cell for anti-aging, it will be last very long if you behave yourself. ហើយក៏បែបបទនៃការរស់នៅរបស់យើងផងដែរផ្លាស់ប្ដូរនៃការបែបបទនៃការរស់នៅរបស់យើងផងដែរបើមិនជាយើងចង់ប្រើប្រាស់ stem cell ដើម្បីប្រឆាំងនឹងភាពចាស់ជរាយើងគួរតែប្រើប្រាស់វាព្រោះវាអាចមានប្រសិទ្ធភាពរយៈពេលយូរ Many type of stem cell can also help cancer. ហើយមាន stem cell ប្រភេទខ្លះហ្នឹងក៏អាចជួយការពារនៅជំងឺមហារីកផងដែរ I give you example. If I can help those who suffer of lung cancer to be better, if they don't stop smoking, cancer will come back. ខ្ញុំសូមផ្ដល់ឧទាហរណ៍ដល់អ្នកទាំងអស់គ្នាឧទាហរណ៍ថាអ្នកជំងឺមួយដែលមាននៅជំងឺមហារីកសួតខ្ញុំអាចជួយព្យាបាលជំងឺនេះបានប៉ុន្តែបើសិនបើគាត់មិនព្រមឈប់ជក់បារីទេគឺខ្ញុំក៏មិនអាចជួយគាត់បានដែរ I can offer stem cell treatment for diabetes. However, if they don't control their diet, their symptom will also come back. ហើយខ្ញុំក៏អាចជួយព្យាបាលអ្នកជំងឺទឹកនោមផ្អែមផងដែរបើសិនជាគាត់មិនគ្រប់គ្រងនៅរបបអាហាររបស់គាត់នឹងរោគសញ្ញាជំងឺទឹកនោមផ្អែមនឹងវិលត្រឡប់មកកាន់គាត់វិញ Maybe Mark can add a comment.
One thing I would like to do, because he's not going to toot his own horn too much, but I've known Dr. Campbell for probably 12 years, and what I've admired about him is he always looks for the best sources, the most well-researched, documented, and the best sources of people as well as product.
ហើយខ្ញុំចង់ផ្ដល់នៅកំណត់មួយចំនួនគឺថាខ្ញុំស្គាល់លោក Dr. Campbell នោះរយៈពេល12ឆ្នាំហើយអ្វីដែលខ្ញុំចូលចិត្តបំផុតចំពោះគាត់នោះគឺគាត់តែងតែស្វែងរកនៅប្រភពឯកសារ នឹងការសិក្សាស្រាវជ្រាវព្រមទាំងធនធានមនុស្សមុននឹងគាត់ធ្វើការព្យាបាល
But it's also like a sports team too. Unless you have an integration, like all of these different therapies. I don't know many clinics in the world, and I've traveled all over the world, that have this kind of progressive therapies available.
នេះក៏កើតឡើងពីក្រុមការងាររបស់គាត់ផងដែរហើយខ្ញុំមិនដឹងថា clinic ដទៃទៀតនៅក្នុងពិភពលោកនោះមានការព្យាបាលបែបជឿនលឿនដូច clinic Vita Longa នេះដែរទេ
But the key here is knowing that everybody is a unique individual. It's not a cookie cutter or a recipe approach to anybody. You have to be, that must be my fibrillator.
ហើយខ្ញុំគិតថាអ្នកនរគ្នានឹងតែតែមានគំនិតតខ្លួនរៀងៗខ្លួន
But how you incorporate those, how you look at what each person's needs are, because they are an individual. Everybody's different. Not everybody can take the same drug and have the same effect, same results. So you have to look at everybody individually, determine and assess through various evaluation modes what is the true source of their problem. You know, what is the etiology, what is the cause, and then work with that accordingly. ហើយមនុស្សម្នាក់ៗនឹងតែងតែមាននៅគំនិតតខ្លួនថ្នាំមួយដែលប្រើប្រាស់លើមនុស្សម្នាក់មិនប្រកបថាមានប្រសិទ្ធភាពទៅលើមនុស្សម្នាក់ទៀតទេអញ្ចឹងមនុស្សម្នាក់ៗគួរតែយល់ដឹងពីបញ្ហាតខ្លួនថាខ្លួនមានបញ្ហាអ្វី And in the process educate that person how to take responsibility for themselves. Unfortunately, most medical doctors and physicians of all kinds do not have the time today to sit down and do that. So it's up to us to change that. When we do take the time, we do teach the individual how to take care of themselves so they may not have to ever come back, right? We don't want to see them again unless we see them on the street happy, right? ហើយយើងមនុស្សម្នាក់នេះក៏ត្រូវមានទំនួលខុសត្រូវសម្រាប់ខ្លួនឯងផងដែរហើយមានដុកទ័រជាច្រើនណាពួកគាត់គួរតែមកអង្គុយជជែកគ្នាទាក់ទងទៅនឹងបញ្ហាទាំងអស់នេះជាជាងការទៅខាងក្រៅដើរលេងនៅតាមផ្លូវវិញ How many percentages Vita Longa can prevent the cancer virus happening? How many percent that Vita Longa can prevent cancer?
Okay. I just like to make sure that we all understand. When I'm talking about stem cells, the main benefit of stem cell is to regenerate yourself, to do what we call tissue regeneration. And on top of that, it can increase your immune system. Therefore, what stem cell does is to promote your immune system.
ខ្ញុំដឹងថាអ្នកនរគ្នានៅទីនេះអាចយល់អំពី stem cell បានដល់ប៉ុណ្ណាទេប៉ុន្តែត្រូវដឹងថា stem cell ហ្នឹងគឺអាចជួយពង្រឹងនៅប្រព័ន្ធភាពស៊ាំក្នុងខ្លួនរបស់យើងបានអញ្ចឹងវាអាចជួយនៅការពារនៅជំងឺមហារីកបាន
And therefore, immune system can help to prevent cancer.
ហើយប្រព័ន្ធភាពស៊ាំនេះគឺអាចការពារជំងឺមហារីកបានការពារជំងឺមហារីក
However, if we want to decrease the tumor size and cells, we may need some other additional treatment.
ហើយបើសិនជាយើងចង់កម្ចាត់នៅដុំមហារីកនេះយើងក៏ត្រូវការការព្យាបាលបន្ថែមលើនឹងទៀតដែរ
Therefore, I'm willing to recommend my patient if cancer drugs can help.
ហើយខ្ញុំក៏ណែនាំផ្ដល់ជាគំនិតដល់អ្នកជំងឺមហារីកផងដែរបើសិនជាថ្នាំអាចព្យាបាលបានគួរតែអាចប្រើប្រាស់ថ្នាំបាន
If the patient cannot respond to cancer drugs, I recommend them some alternative treatment like high dose vitamin C, hyperthermia, and a few others.
ហើយបើសិនជាអ្នកជំងឺនឹងមិនអាចឆ្លើយតបនឹងថ្នាំផ្ដល់ជាគំនិតឲ្យគាត់ប្រើនៅវីតាមីន C ហើយនិង hyperthermia
high temperature.
High temperature.
And many other treatment options.
ហើយនឹងជំរឿនក្នុងការព្យាបាលដទៃទៀត
Like Dr.Mark mentioned, we need to understand that each patient are not the same.
ដូចជាលោក Dr. Smith បានលើកឡើងអញ្ចឹងថាអ្នកជំងឺទាំងអស់ហ្នឹងមិនមែនសុទ្ធតែដូចគ្នាទេ
Cancer patients are also the same. Even they suffer from the same name like cancer the breast, but each breast cancer patient are not the same.
ទោះបីជាអ្នកជំងឺមហារីកគាត់មានឈ្មោះថាមានជំងឺមហារីកដូចគ្នាក៏ដោយក៏ជំងឺគាត់មិនដូចគ្នាដែរ
So we are offering integrative approach.
អញ្ចឹងយើងកំពុងតែផ្ដល់នៅវិធីសាស្ត្រក្នុងការព្យាបាលផ្សេងៗទៀត
Diet is very important. That's why I'm not supporting that many cancer doctors they tell their patient that you can eat anything, you will die in any case. Since we know that the food may contribute to a lot of cancer. So we will teach our patient to control the way they eat. Last but not least, mind control the body. You may have heard that some doctors told their cancer patient that there's no chance for you to survive, you will die very soon. That's wrong, because we need to encourage the patient to die peacefully. And also, I do not recommend that any doctors on earth can claim that they can cure cancer. And also, you cannot be told by me that you will live forever. So I always tell all my patients that even when you die, you can die peacefully, and then you can be on this earth without having to depend on other people. Before I ask Mark to give his comment, I'd like to give you some of my idea. I have long believed that at the age that my older son going to be very old, I will be the father who bring him to nursing home. I am proud to be one of the few fathers on earth that will take care of my son until the day he dies. And by doing so, it will make me always young and healthy. What you think also will cause what you will be in the future. So no matter how old you are, I expect that all you will think like me, that you still have a long life to live and become healthy, strong.
Everything he said I agree with, and I also think that it's very important that his son start listening to him so he lives a little bit longer, right? So he doesn't become debilitated too young. He needs to listen to Papa.
That's right, it's just a joke.
Yes.
Because this is one question. Is it correct that treatment is not
the question is it correct that duty treatment while longer is more effective than other?
Again, I will not like to make that claim because I don't know what every people will do. But I told you that we try to be one of the best. And we like also to promote beauty from within. And if you repeatedly do plastic surgery on yourself, beneath your skin, it will not be so healthy.
ទទួលនៅការវេះកាត់ការសម្ផស្សជាច្រើនដងចឹងស្បែកនៅខាងក្រោមរបស់អ្នកហ្នឹងគឺមិនល្អទេមិនមានសុខភាពល្អទេ
So every cell in the body must be young and healthy as well.
ហើយអញ្ចឹងគ្រប់កោសិកានៅក្នុងរាងកាយរបស់អ្នកហ្នឹងត្រូវតែនៅក្មេងហើយនឹងមានសុខភាពល្អ
And we also believe in personalized medicine. People are not the same.
ហើយយើងក៏គិតផងដែរថាមនុស្សទាំងអស់គ្នាហ្នឹងគឺសិតតែមិនដូចគ្នា
I also believe in feng shui.
ហើយខ្ញុំក៏ជឿជាក់ទៅលើ feng shui ផងដែរ
So sometimes when somebody like to recommend a treatment, if they believe in that type of things, they have also to be careful because some treatment may modify your good luck.
ហើយបើសិនជាអ្នកណាដែលចង់វាកាត់ការសម្ផស្សហ្នឹងអញ្ចឹងគួរតែប្រយ័ត្នប្រយែងជួនកាលតែពេលដែលយើងវាកាត់ការសម្ផស្សហើយអាចធ្វើឲ្យយើងនឹងជួបសំណាងមិនល្អ
And also accept that we are not the same. We have men, gay, women, and different kind of things.
ហើយយើងក៏មានមនុស្សជាមនុស្សហ្នឹងក៏មានប្រភេទខុសៗគ្នាដែរមានប្រុសមានស្រីមានស្រីជាដើមហើយនឹងអ្វីៗផ្សេងទៀត
So we like to create personalized beauty for men who like to be strong, and also for women to be soft and feminine, and also in between as well.
ហើយខ្ញុំក៏ចង់បង្កើតឆ្នាំមួយចំនួនសម្រាប់បុរសដើម្បីធ្វើពួកគេមើលទៅមានសុខភាពល្អនិងរឹងមាំស្ត្រីធ្វើឲ្យមានស្បែកទន់រលោងនិងមានសុខភាពល្អឬក៏ភេទដទៃទៀតមានសុខភាពល្អផងដែរ
And last but not least, we do believe in detoxification and also hormonal adjustment. So for each patient to come to treatment, we also recommend them to do detoxification treatment, maybe hormone balance and so on as well.
ហើយខ្ញុំក៏ជឿជាក់ទៅលើការព្យាបាលដោយការបញ្ចេញជាតិពុលចេញពីខ្លួននិងការព្យាបាលដែលប្រើប្រាស់អរម៉ូនអញ្ចឹងខ្ញុំចង់ផ្ដល់ជាគំនិតឲ្យអ្នកនរគ្នាប្រើប្រាស់នៅការបញ្ចេញជាតិពុលចេញពីខ្លួននិងការប្រើប្រាស់នៅអរម៉ូន
I also do recommend meditation for many of my patients because stress will make them look very old and under pressure.
ហើយខ្ញុំក៏ផ្ដល់ជាគំនិតដល់អ្នកជំងឺរបស់ខ្ញុំឲ្យធ្វើនៅការសមាធិដោយសារតែ stress អាចធ្វើឲ្យយើងនឹងកាន់តែចាស់ជាងមុននិងមានសុខភាពមិនល្អ
So that's what Vita Longa aims to do by provide the treatment which are integrative and holistic.
ហើយនេះគឺជាអ្វីដែល Vita Longa ចង់ផ្ដល់អ្នកទាំងអស់គ្នាគឺផ្ដល់នូវការព្យាបាលជាច្រើនបែបនិងមានប្រសិទ្ធភាព
But the only one thing I want to say about that, which I feel is very important, is around the world, I have seen so much what you would refer to as subclinical hypothyroid, which we're referring to the glands. This is one of the key glands.
ហើយខ្ញុំក៏បានលើកយកមកនិយាយពី clinic មួយចំនួនតើតើនឹងជំងឺតើតើនឹង hypothyroid ជាជំងឺមួយដែលតើតើទៅនឹងកំពេញ
And the lab blood tests for it are not very accurate. And what I would encourage most people to do, is particularly because of all the electromagnetic radiation out today and all the people using microwaves and killing their food with microwaves and just destroying their health.
ហើយខ្ញុំក៏ចង់ណែនាំដល់អ្នកនរគ្នាផងដែរដែលបច្ចុប្បន្នអ្នកខ្លះប្រើនៅ microwave ដើម្បីចម្អិនម្ហូបអាហាររបស់ពួកគេដែលការប្រើប្រាស់នេះក៏អាចប៉ះពាល់ដល់សុខភាពផងដែរ
As you go on the internet, you look up what's called the Barnes thyroid test, B-A-R-N-E-S, and every woman specifically should do this, and men as well, because there's so much hypoactive thyroid out there that's not diagnosed.
បើសិនជាយើងចូលទៅកាន់អ៊ីនធឺណិតយើងអាចឆែកតទៅនឹងពាក្យ hypoactive thyroid ព្រោះតែស្ត្រីមួយចំនួនមានជំងឺតទៅនឹង hypoactive thyroid នេះ Okay, now there's no more for the question. You can ask later.
Okay, I think you have sent us a lot of questions, but I'm sure that many of you may plan to be back. So if those who are interested to ask any more questions, Mark and I ask you here, and we can be willing to answer you. So right now, maybe I ask you to call on this to close the meeting.
I'm very proud that the two doctors are giving so much knowledge today for all of the participants, especially the knowledge of the stem cells. It is very advanced and it is a hope for the future therapy to have a better health. And I hope that in the soon we will have a proper clinic to be able to treat the patient. Thank you.
ខ្ញុំមានមោទនភាពខ្លាំងណាស់ដែលលោកដុកទ័រទាំងពីរបានធ្វើបទបង្ហាញទាក់ទងទៅនឹង stem cell ហើយខ្ញុំសង្ឃឹមថានេះគឺជាបច្ចេកវិទ្យាមួយទំនើបសម្រាប់ប្រទេសកម្ពុជាហើយខ្ញុំសង្ឃឹមថានៅថ្ងៃអនាគតយើងនឹងមានការបង្កើតនៅ clinic នៅក្នុងប្រជាជាតិកម្ពុជា Everyone, this is the end of the seminar, and now we are going to close the seminar. Thank you for your participation. Give us a round of applause. អរគុណអ្នកនរគ្នាសម្រាប់ការចូលរួមនេះជាចុងបញ្ចប់នៃអង្គសិក្ខាសាលារបស់យើងសូមអរគុណអ្នកទាំងអស់គ្នាសម្រាប់ការចូលរួម
Thank you.